Hello, this is Andrew Merritt with ProLiance Orthopedic Associates. Today we have a video of a lateral meniscectomy, which is simply taking out a torn and degenerative part of the meniscus. Now, this individual has had clicking and locking in the knee for a long time, and the outside meniscus, which is the structure on the outer side of the knee, is actually unstable and able to flip in and out of the middle part of his knee joint, causing a lot of locking and symptoms. And what we will see in this video is the steps of removing that tissue for a lateral meniscus. I hope you enjoy and thank you for watching.
This video starts on the inside aspect of his knee for a comparison of what a normal meniscus looks like. Here you can see the meniscus is firmly attached to the outer portion of the capsule and is positioned on the outer side of the knee and stable when we palpate it. Now we flip over to the outer side of his knee where his issue is, and you can see the meniscus looks much different. There's this large fragment that is very unstable. With the probe, I'm able to push it into the middle portion of his knee joint, which is likely the cause of his mechanical symptoms. Lately, he's been having some locking of his knee, and that is when this fragment flips into the wrong area of the joint. In order to solve his symptoms, we need to take this piece out since it is not repairable. We do this in many different ways, and one way that we start to is dividing the unhealthy and torn tissue from the healthy tissue. And we use these small instruments that go through the portals in the front of the knee. This is called a meniscal biter and initially starts to debride some of the tissue, and then we use this device called an arthroscopic shaver that is able to remove the torn and fragmented tissue. This is able to suck back the tissue to just the healthy remaining meniscal tissue that you can see here. Now, there is some fraying still of this tissue, but it's stable to palpation and it stays to the outer side of the knee joint when palpated. This is how you accomplish a lateral meniscectomy when there is unstable fragments of tissue that is blocking the knee. This is Andrew Merritt with ProLiance Orthopedic Associates. Thank you for watching.